I'm really interested in this particular session because for the last 30 years I've had Crohn's disease. It took 2 years to diagnose. I saw about 6 different doctors, and it was eventually a dentist who diagnosed my Crohn's disease. Good old dentists. But by then, I needed to have surgery for part of my bowel to be removed. It's interesting to just see today how far we haven't come in the last 30 years. Certainly, patient empowerment wasn't something that would have been mentioned back then 30 years ago. It was, I am the victim, you are the saviour, you tell me what I'm meant to do. So firstly, we're looking at the example of patient empowerment. Pascal Racheta talked earlier about putting patients at the centre of everything we do. But patient empowerment is often used as a buzzword. How does it actually work on the ground?
I'm going to talk to you today about cystic fibrosis. It's a disease inherited from birth, and it is a disease that comes with it a lot of burden if you want to maintain a good, healthy life. If you do maintain that, then life expectancy over the last 20 years or so has more than doubled. Unfortunately, patients choose their own destinies and their own fates. In almost every chronic disease, the amount of medication that the patient takes is about half what the doctor prescribes them. The solution we came up with is to take the nebulized treatment and to make it easier for the patients to use. So the first thing is we put it in a little device that can be carried around with them. So if they want to go out, they have the device with them, they can take that treatment. We can take them on that device and we can actually train them to use the device in the best way possible. So we can reduce the treatment times from 10 minutes down to about 3 minutes. That's a huge incentive for the patients because it's reducing the burden on their lives. The other thing is the doctors, the physiotherapists can check to see what's going on as well. Patients, if they know the doctor's going to ask them whether they're taking their medication, they'll say, yes, of course I am. In reality, maybe very different. One patient at one of the centres we work with turned up, told the doctor, swore blind that they were taking their medication. The device said they weren't. Oh, well, the device isn't working then. No, the device was working perfectly. And that then started to trigger a conversation. And what the device does as well is it date stamps when the drug's being taken. So, for example, you might see the drugs that aren't being taken lunchtimes. That could be a school child. Well, what is it about your school routine that stops you taking your medication during the school meal time? Maybe if there was an office set aside somewhere that they could go, take the medication discreetly, that would then enable them to take that extra dose of medication, which is so important. I've said treatment times are reduced and we get objective data. Actually, by working with the patients, we've shown that the number of doses taken has increased by 20%. The patients who adhere well have better respiratory health. The patients that don't perform well end up in hospital on intravenous antibiotics again. So by treating the patient as an individual and treating their lifestyle holistically and not just focusing in on one element, there really is an opportunity to change for the better.
The challenges we face today are population aging, complex chronic conditions, and the transition of patient care from the hospital to the community are the main trend that in healthcare services. Frequent readmissions and unnecessary emergency room visits. As a result, hospital costs are the primary expense. Also, we cope with very poor compliance of the patients and very bad mental health and availability and accessibility problems. And finally, there is shortage of professional practitioners, doctors, and nurses. The novel technology call center present a new approach to management of large population with complex chronic conditions and comorbidity. It offers better accessibility to medical advice and empowers the patient in decision-making for improved health outcomes. Our goals in this project in the organization level to provide a support network to assist primary physicians, to coordinate and integrate care with community-based services, to reduce the demand for healthcare services like hospitals, referrals to the emergency room, and other emergency services. In the patient levels, to monitor and provide day and at night care for chronic conditions, accessibility to medical advice for limited patients, better quality of life, of course, performance scores, compliance rates, and satisfaction, all those we check all around the project, to empower patient and their caregiver, their family, and to coordinate and integrate care with community-based services. The center is manned by members of a multidisciplinary team, include physicians, nurses, specialist nurses, nutritionists, clinical pharmacists, and social workers. We use diverse technologies, including telephone calls and video calls. There is always communication, ongoing communication between the team of the MoMA and all the care providers in the community, like the emergency centers and hospitals, the home care unit, etc. Practice is based on advanced technologies such as a smart telephone system based on Avaya technology, which allows to navigate the calls, video technology through specialized tablets that we bring to the patient home, and we connect him in the video, computerized structured validated protocol to support decision making, and task management system, which allows to manage the recruitment and the patient disease management. We believe that when we give a very good proactive service treatment to 10,000 patients, we can prevent of course, hospitalizations, and we can save money of this, but we don't know yet, we just started.
But we did see inefficiencies and lack of resources were creating enormous pressures on the system. The system could not cope with the number of patients that it had to absorb. A rheumatology patient at that time probably experienced somewhere about 6 years delay in some hospitals to get an appointment into the clinic. So if you have to wait 6 years, your time has gone to actually get the benefit from the system that you want. By people not attending the clinics, it was costing that hospital €2 million per year. So the ambition that ourselves and GAY decided to work on was how could we create an environment where arthritis patients could flow easily and efficiently through the healthcare system and get the best care possible from the resources that were there at that time.
Out of a possible score of 10, we found that the mean score was actually just 5.1, and no referral letter contained all of the desired information. With the help of AbbVie, we set up an innovation brainstorming session to discuss the problem and see what could we do, what solutions were out there to help with this issue. And one of the concepts that we came up with was the appointment angel. So the consultant receives the referral, he or she decides the urgency of the referral and makes an opinion about what the clinical problem might be. He orders or she orders the relevant blood tests and x-rays, and then the appointment angel contacts the patient, explains the process, and gives them the date of both the investigations and the appointment. And we found that for the whole group, the no-show or non-attendance rate was 25%. But as you can see from the screen, it was significantly higher in those patients not contacted by the appointment angel in comparison to those patients who were. The cost of these no-shows actually is about €86 per patient. Then this would translate into a cost saving of about €2,500 per patient, per 100 patients, or about €250,000 for 10,000 patients. It was significantly more possible for us to provide a comprehensive assessment at first visit and give the patient a diagnosis and discharge them when they were contacted by the appointment angel in comparison to those patients who did not receive this contact. And again, extrapolating from our data, we estimated that for every 100 patients contacted by the appointment angel, 27 extra new patient appointments were generated. Another project that was developed with the help of AbbVie was the VSNAP project. This is a 60-second video messaging platform that allows us to talk directly to the patient and explain to them what will happen before and during their clinic visit.
But thanks to the improved prognosis of many forms of cancer and treatment is something that you can recover from. So, as a result, increasing number of cancer survivors are able to return to work. How successful return to work is, it really depends on the interaction between person and their work environment. The longer the duration of sick leave, the more difficult it is actually to get back to work. There is a pretty good evidence that multidisciplinary interventions work for people with cancer and other chronic conditions as well, because it reflects the multidisciplinary nature of return to work that involves several stakeholders and so on. A gradual return to work may help, especially for people with cancer, because many times cancer is a condition that requires a long sick leave. So, like gradual return to work, I mean by like that it's possible to combine part-time sick leave with the part-time return to work. If you have support from your employer in terms of helping, that they help you to return to work, it's definitely easier for people with cancer and other chronic conditions to get back to work quicker. There is an example, for instance, in UK. There is a new service that is launched next year, where the primary care doctors are referring their patients who've been on long sick leave, whose sick leave has been lasting longer than a month. So they are automatically referred to a support service. It's also important to develop rehabilitation guidelines that include work as an outcome. And there are several European countries where work has been included in rehabilitation guidelines. People with cancer, once they are quite reluctant to talk about the work-related issues with their healthcare services. They think that it's not really something that involves healthcare services in anyhow. So it is important for people with cancer to emphasize that it is something that you should be able to talk with your healthcare service providers. In many countries, it's health insurance companies bear most of the cost, while the benefits might be for the actual employer or employee. So it's definitely important to consider who is going to pay for the intervention.
Thanks to all our speakers this afternoon. We've had some great practical examples and innovations there. It's now time to look ahead and see what the decision makers need to be thinking about and where there needs to be more thought and discussion to enable healthcare sustainability in the future.